Welcome. I am Terry Tropin, and today I'm discussing the guidelines for selecting device character 5 to build a PCS code from the medical and surgical section. See the videos posted on YouTube for an introduction to PCS and digits 1 and 2, and others discussing digit 3, root operations, digit 4, body parts, and digit 5, approaches. A future video in this series will include digit 7, qualifier, as the final digit in a PCS code. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College for over 20 years. I also have written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external causes. These are available on Amazon. Character 6 in an ICD-10-PCS code indicates the device used. A device is defined as a material or appliance used to accomplish the objective of the procedure. The device remains in or on the procedure site at the end of the procedure. Now, there are some exceptions to this, which I discuss at the end of this video when I talk about guidelines. If no device is used to accomplish the objective, use value Z, no device. If a device was used but there's no specific character for it, use value Y, other device. Remember that all PCS codes require 7 digits. If no digit was used, use value Z, no device. This way you'll get to all 7 digits. You need 7. PCS also defines the difference between a device and a substance placed within the body. A device is intended to maintain a fixed location at the procedure site where it was placed. So device is put in the body and it stays there. If it moves, it may need revision to put it back where it's supposed to be. The device may be removed from the body. It may not be easy to do so, but it is physically possible. For example, a skin graft, that would be hard to remove once it takes place, but it would be possible to do it. A substance, on the other hand, is intended to disperse or be absorbed into the body. Think of a medication. You can see from this picture, medicine in the mouth into the body systems, and it's dispersed through the blood throughout the body. You can't remove it from the body because it moves throughout the body. So that's the difference between a device and a substance. So here's what I'm going to talk about in this video. Types of devices, and there's 3 different types, special device characters, PCS guidelines for device values, the appendixes, and also some review questions. So first of all, types of devices. Devices can be divided into biological or synthetic material, therapeutic material, and mechanical or electronic appliances. Now, the biological or synthetic devices have 2 different types. Some take the place of all or a portion of a body part, such as a skin graft or a joint prosthesis. Others assist or prevent a physiological function, such as an IUD, which of course prevents pregnancy. And I'll talk about each one of these in turn. So let's start with the biological or synthetic devices that take the place of all or part of a body part. These are described as autologous tissue substitutes, non-autologous tissue substitutes, synthetic, or zooplastic. Now, you think of a device as like a pacemaker or something, not as tissue. But in PCS, tissue is considered a device. Autologous tissue substitute is from the patient, taken from one area and moved to another. Non-autologous tissue is human, but not from the patient. It could be from another person or from a cadaver. Synthetic tissue is made from man-made material, and zooplastic tissue is from an animal. Now note that not all of these device values will be available in all body systems or with all root operations within the body systems. Zooplastic tissue. Zooplastic tissue is biological or living tissue, but it's not from a person. It's often from pigs or cows that may be referred to as porcine or bovine. For example, here's a pig, and here are all the many tissues that can be taken from the pig and used in a human. Now, biological or synthetic material is used with these root operations: bypass, removal, replacement, supplement, revision, and fusion. So here you have an example. This is biological, human valve replacement, and here's a mechanical valve replacement. So in this case, biological synthetic material, this is biological, this is synthetic. Now, sometimes device values are more specific than just autologous, non-autologous, synthetic, zooplastic. For example, in heart and great vessels, upper and lower arteries, upper and lower veins, they get more specific. In addition to values for autologous, non-autologous, and synthetic, there's autologous venous tissue, autologous arterial tissues. So it gets a little bit more specific. Here's another example. In the lower joints body system, for removal and replacement values, the synthetic device values are very specific. Synthetic substitute oxidized zirconium on polyethylene is value 6. Synthetic substitute metal is 1. Synthetic substitute ceramic is 3. Synthetic substitute with other than what else is listed is a J. Unicondylar medial, unicondylar lateral, and patellofemoral. So very, very specific device values for these. In root operation, transfer, and transplantation, the type of tissue or specific value is not listed as a device character, but it's listed in the qualifier character. In the device character, it's no device Z, but then in the qualifier value, it gives the body type of body tissue. This will be discussed in the video on qualifiers. Biological or some biological or synthetic material assists or prevents physiological function, not what we've been talking about, which is take the place of all or part of a body part. These assist or prevent a function in the body. Examples of a physiological function is how an organ works within the body. For example, drainage device, extraluminal device, endobrachial device, fusion, intraluminal, tracheostomy, and intrauterine. So for example, a fusion device prevents movement and bending. This is used in the vertebrae. A tracheostomy device, on the other hand, assists in breathing and speech functions. Some devices are classified as therapeutic, meaning part of the treatment for the patient's condition. A therapeutic device is defined as material that is not absorbed, eliminated, or incorporated into a body part, but treats a condition. For example, in this picture, you see mesh is being used to treat stress incontinence in women. Here's some more examples of therapeutic devices. For bones, for fractures, you have internal fixation and external fixation. For example, orthopedic pins, interluminal rods, those are devices used in treatment. In the bone or outside outside the bone. There's also radioactive element implant. These are therapeutic. So these are placed in the prostate, and then radiation is used to treat prostate cancer. Electronic devices are devices that assist, monitor, take the place of, or prevent a physiological function. So these include the same functions as what we've talked about before, except in this case, they're electronic devices. The previous ones were not electronic devices. Examples of these are cardiac leads, diaphragmatic pacemakers, external heart assist systems, and short-term external heart assist system. So all of these here in this example have to do with the heart. But there are other ones that deal with other conditions. We have devices for hearing, devices for fetal monitoring, devices for other kind of monitoring, and neurostimulator devices. So all of these are electronic devices. Now, some devices are external and don't require an incision or a puncture. In this case, these are not reported in the medical and surgical section. They're used from the placement section, not the medical and surgical section. No incision or puncture is involved. These are for protection, immobilization, stretching, compression, or packing. Examples are bandages, casts, packing material, pressure dressing, and traction device apparatus. Note that for a fracture, the external fixation device or internal fixation device is from the medical and surgical section, but the cast itself is for the placement section. And here's some examples of types of casts. Some device values include both the type of device and the number of devices used during the surgery. For example, in the upper and lower arteries and heart and great vessel body systems, the root operation dilation includes values with type of device and the number of devices used during that surgery. So device values for interluminal devices, drug-eluting, giving off a drug after placement. You have 1 device is 4, 2 devices is 5, 3 devices is 6, 4 or more devices is 7. Now, device values for interluminal device, meaning not drug-eluting. You have 2 devices, it's an E, 3 devices is F, 4 or more is G. So it gets very specific about the number, the type of device, and the number used. Other device characters are given multiple meanings within the same body system. This occurs in heart and great vessels, upper and lower arteries, eyes, subcutaneous tissue and fascia, upper and lower bones, and upper and lower joints. So here's an example. In the body system, heart and great vessels, the value for device value 7 varies. It can be either interluminal device, drug-eluting 4 or more, or autologous tissue device. So within heart and great vessels, the root operation dilation takes that device value and defines it as interluminal device, drug-eluting 4 or more. However, in the removal root operation within heart and great vessels, device value 7 is defined as autologous tissue substitute. So let's look at some guidelines on devices. Sometimes the procedure is performed on a device only, not on a body part. Maybe operation when the device is placed, or maybe a subsequent surgery. So if it's only on the device, use root operations change, irrigation, removal, and revision, the appropriate device value within this. So here's an example of devices placed and it breaks. So this may be during placement or maybe subsequent surgery, but the procedure is on the device, not on a body part. So As I mentioned at the beginning of this video, that a device value is used when a device is intended to remain at place where it is being placed during the surgery and it's still there at the end of the procedure. There are, unfortunately, exceptions to this rule. If a device needs to be removed before the end of the operative session, use 2 codes. So it's intended to stay there, but something happens like this break we see here during the same surgery. It's placed and then it doesn't, there's a problem with it. In this case, you're going to use 2 codes, one with root operations for the insertion and another with root operations for removal. So this is a complication. It may also be that they put in a specific size of device and it's not, it's too big, it's too little, and they have to take that out and try another one. So this is one of the exceptions to the device must stay in place rule. The second exception to this rule is when the device value is paired with qualifier values temporary or interoperative. So the device value is there, but the qualifier value says it's only temporary or only used during the surgery. When would you use this? Well, these are used for specific procedures involving clinically significant devices where the device is intended to be used for brief duration. So the point of the device is brief. Brief during the procedure only or during the current inpatient stay only. So here's some examples that may help to just find examples. In the body system, heart and great vessels, in root operation insertion, body part heart, there's a device value for short-term external heart assist system. The qualifier value is interoperative. So in this case, it's short-term interoperative, and you would still use it even if it's taken out after the or before the end of the surgery or during the hospital stay. Another example is root operation value occlusion, also in heart and great vessels, descending thoracic aorta, intraluminal device, qualifier value temporary. So sometimes the intraluminal device is temporary, sometimes it's not. The qualifier value is temporary. That means it may be removed before the end of the operation or before the end of the hospital stay. Here's another guideline. The guidelines also state that if a procedure is performed with the goal of draining a body area, use the root operation drainage with device value drain. Now, if you go back to the root operations, remember the root operation is the point. Why is the surgery being done? If the reason it's being done is drainage, use the root operation drainage. Now, drainage may be a small part of a bigger procedure that's being done, but if the point is drainage, use root operation drainage, device value drainage. Here's a picture of drainage of a nasal septal hematoma. Sometimes a specific device is inserted into the intraluminal space. Use a value for the type of device, not the more general value of intraluminal. So you want to use the most specific device value possible. So here's an example. An intraluminal device is inserted into fallopian tube in order to prevent fertilization. Well, in this case, you're going to use the value for contraceptive device, not intraluminal device. The contraceptive device value H is much more specific to what was going on and what was the point of the surgery than intraluminal device, which could be all kinds of different things. The guidelines also say that sutures, ligatures, radiological markers, and temporary postoperative wound drains are not reported as devices. So here we have a mammography with a radiological marker. This is not, an insertion of that marker is not a device. Use of that mark is not a device. A radiological marker, of course, is used to define the area for an X-ray or for an excision, and it is temporary. The PCS book includes 3 appendixes related to devices. The first is called Device Classifications. This appendix provides guidelines that are not listed in the guidelines in the front of the book. So if you go to this appendix, up at the very top in little tiny letters, there's some important guidelines. Some of these I've already talked about in the book. For example, in this video, for example, this is where the difference between a device and a substance is discussed. Also in this appendix is a table that describes the device type, the definitions, and what we talked about, biological or synthetic material that takes the place of, that kind of thing, and gives you examples. I always think that having examples makes things so much clearer if you can have an example of, oh, okay, then you understand what they're talking about rather than just words. Another appendix is the Device Key and Aggregation Table. This allows you to look up a specific device and find the appropriate device used. Sometimes you'll have a specific device, it's not listed as a device character, you go, wow, what do I use? For example, you can look up Foley catheter in this device key table, and it will say drainage device. So that tells you for a Foley catheter, you use a drainage device character. The device key and aggregation table lists the terms and refers you to the correct device value. More examples. If you look up bovine pericardial valve, it says use device value for zooplastic tissue in the body system, heart, and great vessels. So it gives you a lot of information. A lot of times you'll have a device, the physician will use a device value. Device, you go, I don't know what that is. You can look it up in this table. The device definitions appendix lists specific devices that are coded to a specific device value. It's sort of the opposite of the device key and aggregation table, which lists specific devices and then lists the device value you should use. This appendix lists the device values and lists the specific devices that are coded with this value. For example, if you look up drainage device, it says this is used for cystostomy tube, Foley catheter, percutaneous nephrostomy catheter, and thoracostomy tube. So it's kind of the opposite of the other one. The next section of this video is a review with 5 questions. If you wish, pause the video to think about or look up the answers before starting the video again for the answers. So let's review. During a procedure, a temporary drain is used. The drain is removed at the end of the procedure. The coder should use the device value for drain, not use any device value, use the device value for other device, ask the physician which value to use. The answer is B, not use any device value. This is specifically mentioned in the guidelines with those couple of exceptions. A procedure is performed on a device inserted during a previous surgery. The coder should use root operation, change or irrigation, removal or revision, revision only, or any of these, change, irrigation, removal, or revision. Any of these. Guidelines say you can use any of these. Which of the following would not be coded as a device? Implantable heart assist system, tissue from an animal, synthetic skin system, sutures, all of these, or none of these. The answer is sutures. The guidelines specifically state that sutures are not reported as devices. See the appendix device key and aggregation table. To code for a physio mesh, flexible composite mesh, you should use which device value. So you go to the device key and aggregation table and look this up. And it tells you to use synthetic substitute. See Appendix Device Definitions. An extraluminal device includes which brands of devices? And here are the brands of devices that are used. All of these are coded as extraluminal device. AtriClip LAA exclusion system, lap band adjustable gastric banding, and Realize adjustable gastric banding. There is no way we can remember all the guidelines in the PCS book. Here are some suggestions of things to write in your book to jog your memory. So go to the guidelines B6 and highlight or circle these. A device is coded only if it remains, with the exceptions. List of items not coded as devices, that's in guideline B6.1b, and procedures on devices only, B61c. Those are the root operations that are used for procedures on devices. Note the definitions of autologous, non-autologous, zooplastic, and synthetic, and write those in your book somewhere that works best for you. Now, the appendices are really important, and you might put tabs on all of the appendices in there, particularly the one that gives guidelines. That completes this video. If you have questions or comments, please feel free to contact me. I will be posting videos on Character 7 in the next few days, hopefully at the end of the week. Here again are the books I've written on coding. These are available on Amazon. The easiest way to find them is to go to Amazon Books, type in Tropin, or you can go to this link here. Thank you so much for listening. I hope to have more lessons up soon. Thank you.